I am so honored to be on stage with these two wonderful doctors that we're going to hear so much about their practice. And again, want to thank you all for keeping us safe and doing the COVID testing. And I know that they're also offering COVID testing for departure as well. So if you're interested, please feel free and sign up before you leave today, right? So the Breakers has been in partnership with Premier Health for over a decade. And I remember the very first time I walked into their wellness facility. And I thought I was walking into a doctor's office, but that was not the case. Immediately, the vibe was wellness and energy and passion, but it was a doctor's office. And believe it or not, this was in 2008. So they were visionaries, purely visionaries of their time, because that did not exist. A wellness clinic run by two doctors in 2008. So since then, our partnership has evolved from everywhere. They're primary care physicians for our team members. They have transformed quite a few of our staff members from being unhealthy to healthy. They were co-sponsors for the 2017 Global Wellness Summit with us. They have started executive wellness here at the Breakers, and Paul Leone is one of their first takers, right? And we just opened an on-site mini clinic on September the 9th in Premier, and their wonderful staff, and please thank them all, are here on site with us, taking care of our team members every day. And we look forward to that clinic evolving beyond just a mini clinic for contagious disease testing. So with that, I want to introduce them formally to give you a little bit about their background, and then I'm going to turn it over to them. Dr. Apicella and Dr. Bago, affectionately known as Dr. A and B, are board-certified family physicians that have been practicing in the Wellington community for over 15 years. They are co-owners of one of the largest private practices in Palm Beach, serving over 30,000 patients. They have a unique model of healthcare that ranges from acute to wellness. It's a one-stop shop. Funny fact, they met over a dead body in anatomy class. They shared a cadaver and have been together ever since. And if you didn't know that by their last names, they're also married. They have 4 beautiful children and are truly role models for health and wellness in our community. So I thank you for being here. So I want to ask you a question. You each, I love your story because they're both different, but it's both the same. What drew you to changing your practice from traditional to functional medicine?
Right, and let me start by saying thank you so much, and to the Global Wellness Summit and to the Breakers for having this event, and to our wellness warriors that are here, and all of our virtual followers that are watching everything online. So we're grateful to be here and have this opportunity, and you guys helped to make that possible, so we're very grateful. And the vision really started in 2004 when we first opened and hung our shingle. And what we started with was a vision of how you create an extraordinary well-being for the people that you serve. We always had a patient-centered approach, and then we just started to build a committed team of people that believed and followed that purpose. And for us, it started with building a unique model that really didn't exist at that time, and that was all of your medical needs all in one place, kind of one-stop shop, because we found that the more that we and our mindsets had some control over the patient care, instead of too many cooks in the kitchen, so to speak, we were able to provide a better quality of product overall. So we started off with a primary care that was driven with a purpose of compassion and service, and then that drew to, well, how else can we add value? So we then branched off into having an urgent care and then a diagnostic center. And then eventually that evolved into a wellness center as well, because we started to realize that traditional conventional medicine was not getting us to the endpoints and the results that we wanted.
And a lot of what we did was early on in our practice, we did 4 years of medical school, then we did 3 years of residency. We came out into the world thinking we can, help save the world here. And what we found was we could write prescriptions to improve labs. We could write antibiotics to help with infection and controlled substances for pain, anxiety, and what they were just Band-Aids. And I found myself within 2 years really burnt out. I felt like a pharmacopoeia. I was just writing drugs, and my patients weren't getting better. And I knew back then that we were going to create something different that had a more holistic approach to it. And so little by little, we started adding things like weight loss programs. And we created a 16-week program at that time that incorporated hormone replacement therapy, exercise, nutrition. We dealt with the issues from mental health to emotional health, and just really incorporating this program that really changed the lives of our patients. And we did that back in 2000 when we started, within 2 to 3 years.
And really the foundation of functional medicine starts with the patient. And that's what really makes it special, because through the right motivation and empowerment and adding a little bit of knowledge and education to them, they are the ones that can make the choices to create the change. And that's what we find the most special of what we're doing in our career now.
Has it made a difference in your lives from being burnt out to enjoying what you do?
Well, I think at the end, there is nothing we don't do ourselves that we don't tell our patients to do. We believe to be the model, to be the change we want to see. When I had children and wanted to lose the baby weight, you know what? There wasn't a patient that could tell me, well, I have 2 babies. I go, I have 4, I get it. I'm there to work out with you. I'm side by side. I own a business, so do I. I understand the trials and tribulations. So there's nothing that we didn't do for ourselves that we could teach our patients and let them know they can do it and inspire them.
And we certainly believe that if you're going to deliver a message, you better follow the message. And the truth is that maybe 15 to 17% of physicians graduate with any sort of nutrition background. And if you truly believe that disease starts on your plate, that's not a good place to start. And furthermore, 30 to 40% of physicians are either overweight or obese themselves. So it's really being that model and showing the patients what are possible.
I mean, we actually took a fellowship in anti-aging and functional medicine to get the right training we needed so that we could impact our patients' lives more. So,
Yeah, Dr. A, you sat on a panel in 2017, and I loved your message back then, and it talked about when you went to med school, and it was all about the pharmacy. Can you elaborate on that just a bit?
Well, there's always a place for traditional conventional medicine. We have so much disease in our culture today that there will always be a place for that. But truthfully, 80% of what we take care of, and probably 90% of healthcare dollars, are spent on chronic disease management, which is preventable, reversible disease. And what we have to start having is a different mindset that we don't need an algorithmic robotic approach toward, number one, teaching young healthcare professionals and then deploying those strategies to patients. It needs to start at more of a root cause approach, and it needs to start by empowering the patient to take control and making the right choices.
Can you elaborate, Dr. B, on your CBD background?
So, interesting you say that. I will hopefully have a book that's going to be coming out probably closer to next year, and the title of that's going to be Healthy, Happy, Horny, and High. Let me explain.
Say that again, please.
Healthy, happy, horny, and high. Probably a new way of looking at getting healthy in today's day and age. But it started with me creating a 16-week program that was getting people healthier. What do I mean? It was reducing the amount of medications they used by using lifestyle changes and other alternative approaches. Back in 2011, when the pill mill came and there were all these, the use of or abuse of opioids, we created a program that humanized our patients who really needed medications for pain, but in a very controlled and safe environment. And so that's getting them healthy. But we also looking at more holistic approaches such as meditation and other essential oils, other ways to really address the issues of insomnia, pain, depression, and attention disorders. Then we moved into horny, which is basically just looking at libido, hormone replacement, all the changes that happen in our body as we go through the different stages of life. And then there was about 3 to 4 years ago when medical marijuana was starting to be legalized in the state of Florida. My patients are like, "So, Dr. Bago, are you going to certify us?" And I'm like, "What?" I knew nothing about this. You have to realize I came up Catholic, young girl, straight-laced, everything. I touched nothing. So I made it a point for my patients to learn about medical marijuana and what it is, and I go, well, I do plants now, I do herbs, so this is just another plant. Let me go check it out. And when I started to learn, I really saw the benefits of the medicinal aspect that medical marijuana had to offer for our patients. So I created a program, and now I help certify and treat cancer patients and a whole slew of patients who are in pain, so it's another holistic approach. So
yeah, I didn't want to leave that out of the conversation because when you told me about your book a few days ago, I thought that was very interesting and we should share it here. But I do want to transition in because I know our time is slipping away, and your latest initiative, kind of pre-COVID, and I know you got side-railed a little bit with COVID and having to move your practice just a little bit out of the ordinary, but your latest initiative is the transformation of people. And I really want to spend the rest of our time together talking about that and about your documentary.
So, when before COVID even hit, we started this project, and it really started because at this stage of our career, we want to have more of an impact, and we were trying to figure out, well, how do we get away from an insurance and health and pharmaceutical-driven world where insurance and pharmacy and even healthcare professionals are considered the hero, and shift that picture to where we are nothing but the guide and the patient is the hero of their story. So in our culture, we thought of, well, in order to engage people and have an impact, you either do that through politics or through media, and neither one of us were ready for politics at that point, someday maybe, and media was certainly an avenue to do that. So we wanted to take the program that we have worked on for so many years, and we wanted to deploy that, and we wanted to chronicle the journey of our own patients, a select few, that go through this transformational process. And really what I want to invite you all to watch in this trailer, which it has turned into about a 70-minute feature film documentary on the journey and the lives of these patients that went through this process. And I want to share you guys to enjoy what has been the last year of our lives putting this process together for the most part, and to see what is truly possible, that what we call chronic diseases of things like diabetes are truly really symptoms, and they're preventable and reversible. And when you empower the patient and you show them and walk them through this process, you can really make amazing things happen.
And I just want to add, another reason for this is as much impact as we could do individually to the patients in the exam room, being able to chronicle this and impact thousands of patients to see the results that are there. We're in the wellness. I love this community because we are all cultivating into the same environment. And you've got the medicine side here, the disease part, and then you've got wellness here. But what are we doing to transition, to bridge that? And this video, the documentary is showing all of these elements that we've talked about in wellness, from IV therapy, hormone, mental health, emotional health, connecting with the self, our environment, and bridging that. This is what we show you, that it is possible. 4 concepts or principles of our program is about connection to ourselves and others, accountability, root cause, not Band-Aids, I'm not here to give you a pill, we're finding what's the root cause, and effort, that spells care. That's the self-care that this program and what we hope to really empower our patients and make this personal accountability.
And if we think about what the true clear and present danger is right now that we're all faced with, it's that COVID-19 is not a death, it doesn't cause death through infection, it causes death through inflammation. And what we want to show you is that you don't have to be a statistic. You don't have to gain weight through COVID-19. You can actually still make choices and have the accountability necessary with the right guides to make an impact. So if we could please play the trailer, that'd be great.
And I've always rewarded myself with food.
There's not many foods I dislike, but I just like to eat.
I want to be a normal kid. I want to be able to be faster. I want to be able to be a better athlete.
I knew James had had a weight problem for a long time. He's 13. If we don't do something different soon, he's going to be set.
I went for my mammogram, and when I had the ultrasound, I could tell myself it was cancer.
weight's been creeping up, and about 5 years ago, I was diagnosed with type 2 diabetes.
The most important thing that I'm looking at is your visceral adipose tissue, the amount of fat that you've got in that midsection. If you're over 100, you're at high risk for chronic disease. You're 411. We go into people's homes and we address the epidemic of bad lifestyle in our culture and chronicle it so everyone can see the change.
It's all about what you're nourishing your body with.
High fructose corn syrup. High fructose corn syrup.
If I don't do this, I'm not going to see my 44th birthday, and I'm too young to die.
I'm not going to say this is easy. That's the only way we're going to create change.
He wears me down, and I know this, and I know it's not right. We have to do things differently.
You said that you were ready to make change. Do you want new results?
If I didn't help this kid, I couldn't sleep at night because I saw me as a little boy.
This isn't about a diet, this is about a lifestyle change.
You know how much courage it takes to walk through that door? You're strong, man.
Your own life is in your hands, and it's what are you going to commit to? What are you going to challenge yourself to do? What change are you going to make?
Going through this, I've had to learn to be a gentler, kinder person, especially to myself.
We're looking at transforming you for a lifetime.
Nothing's been as powerful as him being able to feel good about himself.
At the beginning, I was doing it to please my parents. Now I'm going to continue doing this for myself.
The first time I watched that trailer, I cried, and I'm crying now because it's so important. Can you tell the audience what the blob blob fish stands for, how you came up with that name?
So what's interesting is the original title of the program that we thought we were going to call this was going to be TLC, Therapeutic Lifestyle Challenge, because we were going to make it more as a challenge. But as it evolved over time through I call it the onion, right? When we unravel the onion, and I tell my patients, I know you're here, you think you know why you're here, but when you're done with this, you're gonna find you came for a totally different reason. And as we started to unpeel that onion, we started to realize that there was what James identified himself with as a blowfish. He was made fun of by his peers that he felt like this blah of a fish that was ugly inside. And when I had looked at all his records from years and years and years, going to psychiatrists and being labeled as defiant and emotionally unstable, and as you can see, even with his own parents, we started to unravel that. And when we started to heal that little boy inside, you saw tremendous outward happiness, engagement, communication, eye contact. It was incredible. So we felt like blowfish or blowfish would be best represented because that's the story we're telling. We're really healing from the inside out, which is...
It's been a tremendous journey, I think, for everyone involved with this, you know, and you know, our brilliant filmmaker and producer in the back, Andrew, that was part of this whole journey and filmed, and I don't think he even knew what he was getting into when he started this process. And
Andrew, you want to wave?
Andrew waved in the back.
Oh, you're right here.
And you know, so as each person that was involved in this went through it and watched the transformation of these people, you started to see something. You started to see something very, very powerful in that we are in control. You know, when we start to realize that the best insurance company is the one that you never need, and the cheapest medication is the one you never have to take. And so much of what we have to deal with day in, day out is our own personal choices. And we don't need to make excuses. There's no need to blame. There's no value in that, right? We can't blame fast food, or we can't blame the government, or we can't blame anything. Because the truth be told is, with the right guidance and support and love, any person can make these changes. And hopefully we're going to show that.
And obviously the both of you are the support that the people need. A good portion of that documentary was filmed in your clinic, and if you saw just from the trailer, It doesn't look like a medical office. And the two of you are not just doctors. You guys are coaches, man. I mean, you probably just like get right down to the bottom with it, with your patients. So coaches, yeah.
As physicians, I just don't feel like necessarily we can diagnose, and that's fine, and we can educate. But the truth of the matter is people know what they need to do. They just need help getting there. And so for us to just be here and give more information, that's not what we want. We want to give them inspiration, and that's the goal that we want to do with this.
Well, I think that's our time, right? And I just want to thank you both. I look forward to evolving the relationship with the Breakers and Premier Health, and the audience. I'm sure you've appreciated their interaction with you. I do want to call out one last thing. Give it up for the mask and the socks in honor of Veterans Day, right? So thank you. Thank you, guys.
Thank you so much.
Thank you.
Thank you.